The topic that we are going to talk about today is exercise program for the obesity population. So, what is obesity? Obesity and overweight are characterized as abnormal or excessive fat accumulation that might harm one's health. Body mass index or BMI is a basic weight for height metric that is often used to identify human as overweight or obese. It is calculated by dividing a person's weight in kilograms and by the square of height in meters. This is the formula for BMI. Next is the norm for BMI. As you can see here, the overweight is 25 until 29.9 and obese is 30 until 34.9. Now, we want to talk about the cause of obesity and overweight. The essential reason for obesity and overweight is an energy irregularity between calories burned through and calories consumed. The common cause is an increased intake that are high in fat and sugar. Also, an increased physical inactivity of individual. When facing overweight and obesity, it will lead to the cardiovascular disease, diabetes, osteoarthritis, and cancer. Now, let's move on to how exercise can help obese population. Taking a balanced diet is a main part of helping obese population. But doing an exercise also important because by doing exercise, it can help to prevent from any disease. And as the obese population, it can increase the rate of losing weight faster than just taking a balanced diet. Now, let's move on to the exercise.
For now, we go straight forward toward the exercise selections for the obesity community. So we go to the first exercise in my selection, which is the stationary bicycle cycling. So what are benefits for the obesity community? So the benefits of this exercise is to help in reducing the fat loss and help in burning the calories alongside their thighs and all over the body parts. Other than that, it will also help to increase their cardiovascular endurance and get a better heart function. So this exercise can be done for 40 minutes or 1 hour sessions for 2 or 3 days. I would strongly recommend it to do this exercise regularly. So the precaution is we have to make sure when the obesity are doing this, we are sure aware about the complaint about the pain that the obesity community has. The second exercise, which is the modified push-ups. So basically, the push-ups for obesity community have the similarity just like females when they are doing the push-ups, whereas they have to put both of their knees on the ground. So what are the benefits of this exercise to the obesity community? So the benefits are it will help in building strength toward their arm muscles and also focusing on burning the calories at the arms area. So it might lose some weight by doing the exercise. So this exercise can do regularly 2 or 3 days for 12 to 13 reps for 2 or 3 sets. So the precaution is when the obesity community are doing this exercise, we should aware about the posture when they are doing the exercise, as we wanted the effectiveness during the exercise being there. Okay, for now we go to the third exercise for this obesity community. So the third exercise are modified squats. So what are the difference between this modified squat with the normal squat? So the modified squats will having a chair as a support, and it more focusing on helping the obesity community to do this movement easily. So what are the benefits? It will help in building strength on their thigh muscles, and it will also help in burning the calories at the thigh area. So it will have a fat loss on the area. So this exercise can be done by the obesity community for 2 to 3 sets for 14 to 15 reps. The precautions when doing the exercise, the obesity community should choose a safe surrounding area, as we wanted them to have a better experience when doing the exercise, so that when they are falling or have a sudden fall, it might not cause an injury towards them. Okay, the fourth exercise in my suggestions for the obesity community is seated calf raise. So for this obesity community, they have to do the seated calf raise, as we wanted to reduce the injury towards the ankle area and also the calf area. So how to do this exercise? So basically, they have to sit on a chair and make sure that they bend over forwards a little bit and putting some weights towards on their thighs, or they can put their hands or dumbbells. Then they can start slowly to raise their calf. So the benefits of this exercise is it will help in strengthening the calf muscles and also help in burning the calories at the thigh area. So this exercise can be done regularly 2 to 3 days for 13 to 14 reps for 2 or 3 sets. So the precautions when doing the exercise, of course, we wanted them to focus more on their posture, as it will help in the effectiveness of the exercise. Okay, the fifth exercise is the seated bend over row. So this exercise can be done by sitting on a chair, just like the seated calf raise, and they should bend over forwards a little bit, so that it will help in posture when doing this exercise. So then they started to raise their hands backwards, and there is the movement of bend over row. So this exercise will help in giving strength towards their back muscle, and also increase the ROM of their shoulders. So this will help them become more movable towards the shoulder joints, and it will decrease the difficulty of moving it. So this exercise can be done regularly for 2 to 3 days for 14 to 15 reps for 2 or 3 sets. So of course, the person who are doing this, which is the obesity community, should aware about the body posture, and also make sure that they are using a reasonable load to be added during the exercise.
The exercise that we are going to do is a lateral step pull. It is a cardio move that keeps your heart rate up, warms up the muscles and joints, and boosts the metabolism. This exercise activates all muscle groups, improve muscle endurance, and promote relaxation. While doing this exercise, you must keep a steady pace, engage your core muscles, and breathe in as you bring both hands together above your head. Maintain your upper body face front and keep your back straight. Breathe out as you pull your arms back and keep your toes pointing in the same direction as the knees. The pros for doing these activities, it will help to increase your heart rate and boost your metabolism. For cons, it will be disadvantage if the person doing the wrong technique, because it will lead to other complications. Next is standing side bends. It targets external and internal obliques and strengthen the side abs wall. This exercise helps to sculpt the waist, tighten the core, and improve your posture ability. Precaution while doing this exercise: face front, engage your core and don't lean forward nor back. Keep your head and neck neutral and breathe as you bend to the side. Go as far as you're comfortable, pause for a second, and exhale as you return to the starting point. The pros for doing this exercise, it will focus on your side abs wall to make your waist slimmer. And for the cons, if you do the wrong technique, you might injure the waist. Next is arm swing. It is a great dynamic stretching that focuses on muscle in the upper body. This exercise exercise will prepare your muscle before doing any exercise. This exercise also gives a great cardio boost and increase your flexibility. Keeps your abs tight and your back straight. Face forward, breathe slowly and use your muscle to propel the movement. Your arm should swing in a steady position as close as possible to their full range of motion. The pros: by doing this exercise, you will not get muscle strain because you already prepare your muscle from this warm-up exercise. The cons is if you don't do it properly, you will get muscle strain. Now let's move on onto the hip circle. It's helped loosen the lower back and hip muscle, strengthen the core and trim the waist. This exercise also can increase your flexibility. Keep your body relaxed and face forward. Engage your core muscle and breathe deeply, maintaining a steady rhythm. Start with a small circle, then increase the diameter over time. Pros from doing this exercise: it will make your waist slimmer and help you to release tension. The cons is if you don't do it's hard for you to get ideal body. Next is arm circle. It helps to warm up your shoulder, arms, chest, and back. This is a great exercise to incorporate at the beginning of an upper body workout to prevent injuries and prepare body for strength training. Engage core muscle, keep your back and your arms straight, and maintain a smooth and deep breathing pattern. Keep your head up and your body in a T position. The pros: by doing this, it will loosen your fat around your underarm, and the cons is you will get tired if you do it for a long time.
The first exercise that I'm going to show you guys is the lateral steps. The reason why I choose the exercise is because this exercise is very suitable and easy to perform for people in obese population. The pros and cons for performing this exercise is: the pros, this exercise is easy to perform, easy to execute, and recommended for the beginner. And it also can improve body muscle endurance, promote relaxations towards the body and joint. And the cons for this exercise: the exercise did not be performed in the correct posture. It will put a lot of stress to the knee area. Next, the precaution to performing the exercise: you need to make sure that you need to always lock your back, chest up, and standing straight. Next, when performing the exercise, you need to always make sure to not overstretch or over-rotate your hips, as it can cause injury if you do it excessively. Do this exercise for 15 reps for 2 sets. Step back jack. The reason why I choose the step back jack exercise is to burn fat on the lower part of the body, such as glutes, hip flexor, quadricep, and hamstring. The pros of performing this exercise: it will strengthen the knee with the exercise that will be done, and other than that, it will also improve the hip rotator and lateral moving muscles. The cons that need to be watched out when performing this exercise is: this exercise need a good sense of balance when performing this exercise. So we are going to proceed with the precaution of the exercise. To perform this exercise, you need to always remember to lock your back, to stand straight, and chest up. Or not, you will have trouble by experiencing back pain. And also make sure that your knees does not exceed your toes when you're performing the lunges movement. And for the last one, do not overstretch your leg or any part of your body while performing the exercise. You can do the exercise for 15 reps and for 2 sets. Knee drive. The reason why I choose this knee drive exercise is because this exercise is very suitable for an obese population, as it is very low intensity. Other than that, this exercise is to burn fat and strengthen the lower extremities area. The pros for me this exercise is it will increase the body stability, especially on the knee area when you're performing the exercise. And the precaution that you need to look for when performing the exercise is you need to always chest up and lock back, just like you're doing other exercise, to maintain good posture and to prevent back pain. And next, do not jerk the knee when doing the movement. Do the movement correctly and safely. Next is wear suitable shoes and equipment to prevent any injuries. You can do this exercise for 15 reps and 2 sets. Diagonal abs. The reason why I choose this exercise is to burn fat on the stomach area while targeting the lateral abdominal muscles. The pros of the exercise is it will improve body posture and boost your confidence. Precautions that need to be followed when to perform the exercise is chest up and lock back, and do not jerk your movement because it will be very dangerous for your back. And do this exercise for 15 reps and 2 sets. Plank reach. The reason why I choose the exercise is to burn fat on the core area, especially abdominal. And the target muscle for this exercise is the oblique and abdominal, your lower back, and also your shoulder. The benefit of performing this exercise is you can to strengthen the core muscle, to increase the muscle endurance, and also to improve body posture and stability. The cons of performing this exercise is this exercise might be considered as high intensity in the obese population, but it is still very doable. Next, we are going to proceed on the precautions of the exercise. The precaution that needs to be looked out for is you need to remember to always lock your back during the exercise. Next is make sure that the plank posture is very good so that the weight of your body can be distributed properly. And for the third precaution, it is do not attempt any hyperextension or any hyperflexion movements. And the last one is use the mattress so that it will put less stress on your knee and your elbow. You can do this exercise for 15 reps and 2 sets.
For the conclusions, all of this exercise is highly recommended for the obesity community, as we wanted to reduce the number of obesity in Malaysia, especially because Malaysia is currently at the highest level when it comes to the obesity. So by doing the exercise, will help the obesity community in getting healthier than before. Other than that, in my advice, the obesity community should get back into the healthier lifestyle, even though nowadays we have to experience the restrictive movement order from the government due to this COVID-19 virus disease. So do this exercise regularly in order to help them burn their fat and also burn their calories along at the body parts. So that's all from us. I hope you enjoy our video. Thank you.